these, but maybe there's new people joining in. So welcome. I'm the Director of Health and Fitness at the Reh-Fit Center, and I'll be moderating the talk tonight. My name is Rhea Vogts-Olafsson. If you have questions, you can use the chat box at the bottom. You can enter your questions at the end of the talk. We'll allow for a few minutes for those questions, and myself and Diana will kind of field those questions. A few more people coming in. It's a great turnout tonight. So I will pass it over to you, Dr. McMillan, and I will mute myself, and I'll just kind of keep letting people in as they come in. And good luck. Have a great talk.
All right. Well, thank you. And thank you, everyone, for joining this presentation this evening. I'm really excited. This is my first presentation to the Reh-Fit Center, and I'll really look forward to hearing your questions at the end. I'll leave some time for questions. So I really wanted to share with you a little bit about sleep health, and particularly, you know, as Rhea said, it's quite a challenge during this pandemic, but it's important for us at any time. So I want to cover a few different things. I just want to see whether there. Whoops. There we go. So I would like to cover what sleep is a little bit, and what regulates it, why we need sleep, some of the changes that happen to our sleep because of age, and a few aspects about sleep disturbance, particularly during COVID, and then close on a number of sleep strategies that we can all use to better improve our sleep as well. So what is sleep? Well, sleep is actually a reversible physiological and behavioral state. And it's something that we do that is, the more I learn about, the more I realize is absolutely critical to our health, our physical health and mental health and well-being. And if you think about it, we sleep from 2/3 to 1/3 of our life. And that's a huge amount of time to be doing something or being in a particular behavioral state. We also know that sleep, according to the way we as researchers and clinicians describe it, has two major sleep states. And one is called non-rapid eye movement sleep, or non-REM sleep. And that's composed of 3 stages. Stage 1 is very light. You've sort of basically drifted off to sleep. If I walked past your bed, you'd probably waken up. The second is stage 2. Your respirations are getting a little bit slower. Heart rate maybe is a little slower, but you still have quite a bit of muscle tone. What we see here are some bursts of electrical activity in our brainwave patterns that are called sleep spindles, and we think they're probably associated with reorganization of our memory. And also some major depolarizations called K complexes. From stage 2, we typically move into stage 3, or also called slow wave sleep. And there are lots of very high amplitude slow waves or delta waves. And stage 3 sleep is particularly important for our extremities, our toes and fingers, to have really good perfusion or blood circulation to them. So really important that we get all stages of that non-REM sleep. After about 70 to 90 minutes after falling asleep, we progress to what is known as rapid eye movement sleep. And probably most of you have heard about REM sleep and its association with dreaming. Well, it is true. We do dream in REM sleep, and dreams are quite vivid. Interestingly enough, actually, we also dream in non-REM sleep. But if I was to wake you up in non-REM sleep when you're dreaming, you would have such a fleeting recollection. You'd know you'd been dreaming, but you wouldn't be able to recall it. Whereas if you are awoken in REM sleep from a dream, you probably could describe in quite great detail what the dream was about, maybe the colors, the smells, the activities that were going on. So there's something very different cognitively that is happening. Interestingly as well, during REM sleep, we have irregular heart rate. respiratory rate, and we have surges in our blood pressure. And as well, temperature control is very different than in wake or non-REM sleep. And the other thing that is quite classic for being able to determine whether you are in REM or not is your muscle tone, because our body provides a protective paralysis. So our brain offers a sort of a suppression of our muscle tone. And so aside from our respiratory muscles, which we definitely need to be working well, and our eye muscles, which
I've got the headphones plugged in for you.
Oops. Which have some saccadic eye movements or sort of jerky eye movements. The rest of our muscles are quite limp. And this is probably a very protective thing, because if we are dreaming vividly, we want to make sure that we're not jumping up or acting out our dreams. And in fact, one of the things that some individuals have is REM sleep disorder, where they're actually don't have that protective paralysis. So we really want to make sure that that's in place if we can. Now, we cycle through these sleep stages about 5 or 6 times over the course of the night. And as you can see by this bat, we as humans may be night sleepers, but other creatures are daytime sleepers. Cats, for example, and rats are creatures that sleep during the day and are awake at nighttime. So what are the factors that regulate our sleep? Well, there are 3 factors. And the first that I want to talk a little bit about is the biological clock called the suprachiasmatic nucleus. Now, every time I say that word, I want to sort of jump into a Mary Poppins song. So I'll try to control myself. But for those of you who like Latin, supra is above. And you may recall that the optic chiasma is the crossover of our pathways from our eyes to the back of our brain. And so this bundle of nuclei sit at the top of that crossroads. And these nuclei are sensitive to light and dark, and they help to entrain our circadian rhythm. Now, here's a little factoid, and that is our circadian rhythm is actually closer to 25 hours, not 24. Now, why that is a very curious thing, and we don't really know. But what we do know is that we entrain our rhythm and sort of reestablish that on a daily basis. And we do that through our social cues, our alarm clock, going to work, going out for our daily walks, and things like that, that help to sort of get all of these other body hormones and functions all in the same cue. And so that circadian rhythm, that suprachiasmatic nucleus, drives other hormones like growth hormone, which is almost exclusively secreted during sleep, and other hormones like cortisol, which is a stress hormone, or melatonin, which you may be familiar with as something that makes you sleepy. It's an endogenous soporific hormone. Now, newborns have a very immature circadian rhythm. Teens like to be night owls. They would like to stay up late and get up late, so they're phase delayed. And as we age, we tend to be more phase advanced, wanting to go to bed earlier and to rise earlier. So this circadian rhythm, in a way, is much like if you think about a symphony. So if you think about a symphony, there are many different instruments playing for, say, Beethoven's Fifth. You've got the flutes and the strings and, the oboes and the timpanis. And they are all playing the same piece, but they're not all playing the same note. And they don't come in at the same time, right? And so they follow a conductor, sort of much like our suprachiasmatic nucleus, and they need to come in on cue. And when they do, it can be a glorious symphony. And if they don't, it just sounds like cacophony. So in this figure here, you can see that there are different rhythms to our various bodily functions. So if we start at the bottom, which is midnight, we see that our deepest sleep is around 2 in the morning. Our lowest body temperature is close to 4:30 in the morning. We have a sharp rise of blood pressure about 6:45 in the morning. Our melatonin levels have dropped to almost zero, so that we should awaken refreshed and alert. We'll probably need some private time around 8:30. We have a highest testosterone around 9. We're the most alert at 10 in the morning. Best coordination at 2:30. Fastest reaction time at around 3:30. Greatest muscle strength around 5 p.m. We have our highest blood pressure around 6:30 at night, and our highest body temperature at around 7. And then by 9 o'clock, our melatonin levels start to rise to help us to begin to feel sleepy, and to keep us asleep during those early morning hours. And over those sleep periods, our digestive system is in a sort of a quiescence, or very quiet, to help us stay asleep. So the second coordinator of sleep is a coordinator and a switch, and it's composed of the reticular formation and the reticular activating system. And these components take information from the external, our senses, our eyes, our ears, what we're taking in, and the information that our body, in terms of our heart rate and blood pressure, are registering, but also in terms of what our higher cortical levels are contributing. And in this way, we need to have both a calm mind and a calm body. So let me give you an example. If you are, say, Blake Wheeler, and you're just out playing a really great game of hockey with the Jets, and you have been skating really hard, your heart rate is going to be high, your blood pressure is going to be up, you're going to be having a very high metabolic rate, and it would be almost impossible for him to go to sleep immediately after a game, right? Similarly, if you had just been watching a really scary movie, or something that was really frightening you or making you very upset, your mind might be racing. And you would also be finding it extremely difficult to fall asleep. And we'll circle back to this idea later on when we visit some of the strategies that can help us get better sleep. The third factor is the homeostatic drive. And basically, our need to sleep increases the longer that we're awake. We've probably all had that experience where we're watching a movie on the couch and we really would like to see the end of it, but we're tired and we fall asleep. Worse yet, we may be driving, and I do quite a few workshops with the RCMP as well, and they tell me that people often fall asleep at the wheel. They never hit the brakes. And so despite our knowing that, being in a car and falling asleep is not good for us or anybody else on the road, that drive to sleep is so great that we shut our eyes and drift off. Now, why is that? Well, our energy is depleted during wake, so that is partly the reason. But we also see that there is a buildup of toxins. Adenosine is one of those, and that's why actually caffeine, which is an adenosine antagonist, gives us a little bit of a perk. But sleep, or the lack of sleep, is more than a buildup of adenosine. And one of the most interesting discoveries, I think, probably in sleep in the last 50 years is the discovery of the glymphatic system. Now, I don't have a speech impediment, and I did say glim, not lymphatic system. And that is a series of channels that were discovered in about 2013 that perfuse the deep into the brain with the cerebral spinal fluid. And this glymphatic system, these channels are closed when we're awake, and they only open while we're asleep. And they allow for a very wonderful, almost like a pressure washer, it's been described as, of fluids into the brain to sort of wash out the toxins that have built up, and to also provide the necessary nutrients to the brain, which is a very active organ. So what are some things that you might have heard about? I don't know whether you've had a talk yet on the 24-hour movement guidelines for adults, but I was very excited. These were released in about the 15th of October this past fall. And for the first time, these guidelines have included not only sedentary behavior, but sleep as well. And some of you may remember them as the participation guidelines. And so now we're looking at not only moving, but reducing our sedentary time and also sleep. And so these guidelines are a great thing to have a look at. And the ones related to adults 18 to 64 and 65 years of age and older, as I said, were released just recently this fall. So what are some of the age-related changes? Well, first of all, let me dispel you of a myth. And one of those myths is that we need a lot less sleep as we age. Well, according to these guidelines and other research that is supporting them, it suggests that adults need 7 to 8 hours of sleep, good quality sleep per night. And adults that are 18 to 64 years of age need 7 to 9. So that's really only 1 hour difference in terms of the recommended hours of sleep offered. Now, some people don't get that much sleep, but there are many reasons related to that. And that could be health or mental health, or it may be other stressors or socioeconomic factors that are contributing to sleep disturbance or tiredness. So if you factor out other influences, there isn't really that much impact on aging. What we do know is that we tend to have a bit more difficulty falling asleep, typically going from about 10 minutes when we're younger to maybe upwards of 30 minutes as we get into our older years. Our sleep tends to be a bit more fragmented and lighter, and we shift to that early to bed, early to rise. We might waken refreshed, but we might tire a bit more during the day. And oftentimes we find a nap can be helpful with that. And we might be less satisfied with sleep as we age. And we also know that many individuals, particularly as they age, use medications to help them sleep. Our sleep needs vary by our age. And as I said, when we have periods of rapid growth, in children, for example, you can almost know when they're having a growth spurt by the fact that they're sleeping so much more. But in addition to age and growth, our sleep needs vary by our health, and whether that is mental stress or depression or physical illness or recovering from an illness or surgery, those certainly can impact our sleep needs, or a flu. Even if we've had are down with the flu, that's probably one of the first things you want to do is crawl into bed with a warm blanket and have a nice sleep. Genetics does play a role, but it plays much smaller role than most people think. There is a tendency for some individuals to be more night oriented or daytime oriented, but in most instances we are nighttime sleepers, and we need about 7 to 9 hours of sleep. The other factor that contributes to our sleep needs is how much sleep debt we have. And sleep debt is that idea that if you are an 8-hour sleeper and you're regularly only getting 7, then you're sort of feeling shortchanged, and that can add up to the point where you are really feeling tired. The other component is our circadian rhythm. So there are times of the day where it's very difficult to sleep, such as right around 6 o'clock in the evening. sort of between 5 and 6, it's usually very difficult to sleep at that time. So our circadian rhythm plays a role as well. What are the things related to sleep and heart health? Well, there's a lot of research that is still needed, and I'm excited to be part of that. But what we have seen is that good sleep may enhance recovery following heart surgery. There was a study done by Poole and colleagues, 230 patients that had a coronary artery bypass graft surgery, and those that were reported greater sleep complaints before their surgery had more physical symptoms and poor health-related quality of life and more pain following the surgery. So we need a bit more research to determine whether we can improve sleep preoperatively to see whether that can help with post-op outcomes and recovery. And there are also still some questions about whether we can, within the heart health or the cardiac population, improve our sleep health following surgery to enhance recovery. But based on the general literature about what sleep does, I would say the chances of improving health and recovery are really quite strong. And here's why. So if you are acutely or chronically challenged with your sleep, and these are findings across the ages, you're tired, right? All of us have probably experienced some fatigue if we've been up late or had to get up extra early. We also know that there's cognitive impairment, and that can be quite mild to even delirium. And so I do some work with Dr. Rakesh, who you may have heard earlier this week, looking at sleep and delirium. We also know that we're clumsier. We're more likely to have motor impairments, falls and fractures. We have changes in our cardiovascular systems where it contributes to our increased blood pressure. And our mood changes as well when we are getting either insufficient amounts of sleep or that sleep is disturbed. We're more anxious, we don't cope as well, we may be more depressed. We see changes in our hormones. Growth hormone, for example, I said was secreted almost exclusively during sleep. And we need growth hormone not only for growing, but for everyday tissue repair. And so that's a really important component for us and for anybody who is recovering from surgery or illness. Another important factor is that we don't regulate our blood sugar as well if we are sleep deprived. And it's almost like being in a state of type 2 diabetes. We become insulin resistant. And with that higher amount of sugar in our blood, we're more prone to infections because bacteria really like sugar. If we're exposed to bright light, that will shut down our secretion of melatonin. And melatonin, as I said, is that hormone that helps us to feel sleepy and fall asleep and stay asleep in those early morning hours. But there's some interesting research as well to suggest that melatonin, it may be a free radical scavenger or something that sort of helps to scoop up cells that are a little bit abnormal that could develop into tumors and cancers. So the role that melatonin plays in our body is still becoming explored, let's put it that way. We also see that there are immunological challenges when we don't get enough sleep. We don't respond to fight an infection as quickly. And so that's really important to make sure that we're fighting things and building up immunity. I mentioned about our circulation. We want to have that really nice perfusion in our extremities and our fingers and toes, and that comes about with getting good amounts of that stage 3 or slow wave sleep. I mentioned the glymphatic system, and we also know, and this is some of the work that I did as a doctoral student when I was in Seattle. And what we found was that we experience much more pain for a given pain insult when we have not had a good night's sleep. sort of adding insult to injury, really. The other thing that is relevant for us, and certainly to make sure that our hearts stay healthy, is that when we are tired, we eat more than our energy requirements. We oversecrete ghrelin, which is the sort of hunger hormone, and we suppress the leptin, which is sort of the satiety hormone. And the end result is that we want to eat high fat, high sugar foods, and that's just not going to add anything but empty calories. The other problem is because we're more emotionally vulnerable and maybe not coping as well, we like those comfort foods. And so that increases our risk of obesity. So what causes sleep disturbance in adults and older adults and in younger folks as well? But insomnia is one of the major contributing factors. And clinically, we describe that as a difficulty with sleep initiation or maintenance, or refreshing or non-restorative sleep. And there are a whole host of factors that can contribute to that, particularly for the older adults. It could be environmental, behavioral, social, spiritual. More females than males tend to be experiencing insomnia, and a number of medical issues as well. So just to give you some examples, if your bedroom is very noisy, you may be living near very noisy neighbors, or you have a very noisy dog or something that keeps you awake, that's going to be disturbing for your sleep. You want a bedroom that is not too hot or too cold. And you also want to have it to be fairly dark. So you don't want to have any light exposure during your sleep period. You also want to make sure that you're getting enough light during the daytime, again, to help you entrain that good, strong circadian rhythm. And it may be other environmental factors, like maybe you had to move to a new home or a retirement community or a personal care home, and you're really not sure about or find that move a bit stressful. Some behavioral and social factors, irregular sleep schedules, or especially if you're doing shift work, late day caffeine use can be problematic for many individuals, or alcohol near bedtime, or excessive napping. Remember about that homeostatic drive. And so if you have just had a really good sleep, it's going to be harder to build up that sleep pressure to fall asleep. And so you want to make sure that if you do need a nap, that you have an early afternoon nap so that you can build up that drive to fall asleep and stay asleep during the nighttime. Other things that can influence your ability to sleep or insomnia is the reduction of those circadian cues. And so, making sure that you can try to get out and get some daytime light will help to entrain that rhythm. Responsibilities at work or caregiving, family, can all contribute to disturbances in your sleep, even though you may want to get up to look after other individuals in your family or babies. You need to do that, but it certainly can be sleep disturbing. Hospitalizations. Hospitals are a terrible place to get any sleep. And or if you've had any new problems in your health or ongoing health problems, they can add to that. Certainly any death or illnesses in your family, or loneliness, or even boredom can contribute to poor circadian rhythm, or inappropriate use of social drugs as well can add to those complications. Spiritual factors are also part of what we know can contribute to challenges in our sleep health, and whether it's being able to find peace or whether you're in a spiritual crisis really can tip the balance in terms of being able to get restful sleep. Medical factors, there are a whole host of different medical factors that contribute to sleep disturbance, including various drugs. So theophylline, for example, or any kind of thyroid hormone. Decongestants can as well, opioids, and there's a real range of medications. And so, you should, if you are having trouble with insomnia, and you've started a medication, that's something to go back and have a chat with your healthcare provider, because they may be able to change exactly which medication or balance of medications you're on to help you with better sleep. Sleep disorders, there's a whole range of them, but one of the most common is sleep apnea, where you stop breathing maybe 400, 500 times a night, and that can really contribute to increased blood pressure. And it's certainly something to make sure that you discuss with your family physician or nurse practitioner, and to get a referral to the sleep disorders clinic to get that sorted out. But there are quite a few other sleep disorders that some individuals have, and again, helpful to get that followed up. Psychiatric and cognitive conditions can contribute to our inability to sleep, as well as other medical conditions, diabetes, hypertension, any kind of respiratory distress. Anyone who's got arthritis, for example, is more than twice as likely to have trouble with insomnia. Added to all of this, what are some of the challenges that are specific to the pandemic? Well, the pandemic has really been a huge disruption of our daily lives, and it can alter our circadian rhythm. People may be at home, or they're not having their normal routines. Many individuals were maybe staying up a lot later than they ordinarily would. And so that can pose an additional challenge. Certainly anxiety and worry and depression, isolation, greater family and work stressors, excessive screen time, and stress-related fatigue, so that you're tired but not in a good way. And we know that good sleep can help us cope and problem solve better and stay physically and mentally healthier during the pandemic. So it's certainly something that we want to pay attention to. So how do we know how we're doing, or how maybe some of our family members are doing? As sort of a quick litmus test, you can think about this 30-second interview that was adapted out of a JAMA article out of the Journal of American Medical Association. And there's some simple questions. Do you have trouble falling asleep or staying asleep? Are you sleepy in the daytime? How much sleep do you usually get? Are you getting the 7 to 8 or 7 to 9 hours that are recommended? Do you wake up to use the bathroom? If you do you go to the bathroom once and then are you able to fall asleep or right away? Or are you getting up maybe 6, 7 times a night, right? And that's really sleep disturbing. Do you awaken too early? Do you snore, or does your bed partner, if you have one, tell you snore or stop breathing? Do you have any uncomfortable sensations in your legs? What helps you sleep and what makes it worse? So if you or your family member or someone you know is having some challenges with those questions, it's probably time to go back and see your healthcare provider and have a discussion about ways you can address your sleep health. So here's some ways that we can all take charge of our sleep. And these are things that we can do certainly to augment and support good sleep health. And it's really hard to go to sleep if you're starving, right? So I don't recommend having a big meal, certainly not a big meal even a couple of hours before bedtime, because you can end up getting gastric reflux. But you don't want to go to bed really, really hungry, because you'll probably wake up in the middle of the night. So half a banana, maybe a little bit of protein, maybe cheese and crackers or something will help with that. You definitely want to gear down, particularly during this pandemic. It's very easy to sort of get rattled up watching the news even. And so you want to avoid that blue light near bedtime, because we don't want to suppress our melatonin. So watch the screen time, or maybe get an app to reduce your amount of light, and do some kind of routine that helps you feel relaxed and calmer. Remember that reticular activating system. We want a calm body and a calm mind. We suggest that you restrict time in bed. Recognize that you certainly may need more sleep during illness or recovery, but you don't want to be spending a lot of time in bed. beyond your sort of recommended hours because you are maybe not getting enough exercise to help you feel tired in a healthy way to fall asleep. And if you are having difficulty after about 30 minutes of, after you've gone to bed and you still can't fall asleep, I suggest that you actually get up and do something that is easy, like maybe a very easy Sudoku, or read a very short magazine or something. Don't pop in your favorite movie. Don't start reading a Stephen King thriller or anything. But you want to do something that is going to be short, time limited, that makes you feel a bit sleepy. And when you're feeling sleepy, you go back to bed. The idea is you want to associate your bedroom with calmness, and basically keeping it for sleep and sex, and an oasis for relaxation. If you are having a nap, try to keep it to 20 to 30 minutes early in the afternoon, and definitely try to keep to a regular schedule, particularly having the same wake up time. That will really help to entrain your circadian rhythm. Watch those stimulants, that caffeine, alcohol, and nicotine. Regular exercise is really great. And if possible, if you do vigorous exercise, try not to have it too close to that bedtime. A warm bath or a shower 1 to 2 hours before bed can be really relaxing. Just make sure your hair is nice and dry, otherwise that you might feel chilly with that. Your bedroom should be quiet, dark, comfortable, and a little on the cooler side. And look at that mattress. Does it look like a camel? After all, you're sleeping a third of your day. So you deserve a really good mattress. Does it need to be flipped? Have you vacuumed it lately? Those sheets should be nice and clean and breathable if possible. You might need some support for any sore joints, and make sure if you wear pajamas that they're also breathable. And all of these linens should be washed fairly regularly. It sounds kind of grim, but we slough off little bits of dead skin cells in our sheets, and we sweat and perspire and things like that. And what you'll find, and this is what I would recommend you do, is this weekend, have a good look at your mattress and in your sheets. Make sure they're looking good and fresh, and then have a shower so that you tuck yourself into clean sheets, clean PJs if you wear them, and a clean bed, and you will just feel absolutely delicious. Bright light therapy can be helpful for some folks, especially if they have any kinds of seasonal affective disorder. And it can also help to entrain that circadian rhythm, but we don't need necessarily to have an electric light or those, fancy lights that you can purchase. Just even a nice light exposure to the window or a morning walk, daytime bright light is really going to be helpful for that entrainment. So while all of those strategies that I mentioned, though, are often called sleep hygiene strategies, they're always the first line of treatment for any kind of insomnia. And that's all been agreed upon by, the sleep clinicians and researchers. Certainly our best line of attack for insomnia. And we also know that several other approaches can be helpful that are non-pharmacological, and includes distraction or imagery, relaxation, massage, meditation, mindfulness, yoga. So, I often recommend that people have a sort of a toolbox full of things to try, and you see what works for you. In addition to these kinds of non-pharmacological strategies, when we think about the pandemic, we really want to think about also setting that schedule and routine. It will help us with some sense of normalcy and making sure we get that wake time, gear down time, and regular bedtime. That regular daylight exposure, great for an entrainment, and also research is supporting that the vitamin D that we get from the sunshine is helpful too. That staying active as we can helps to increase our healthy fatigue and can reduce our stress, so long as we do it in a socially distanced, safe kind of way. that limiting that screen time will help to reduce our stress and also reduce the amount of blue light, which suppresses our melatonin. So we want to be careful about that. And practicing kindness to ourselves and others can help with our stress levels as well. Fostering that safe connection, limiting news and social media, and watch what you eat, drink, and smoke. If you haven't stopped smoking, sleep disturbance related to nicotine is another good reason. So what if good sleep is still a challenge? Well, I really encourage you to discuss it with your nurse practitioner or family physician. You may need a bit more assessment in either sleep or there may be some other underlying conditions or contributions with your medications that are exacerbating your insomnia. So what about medications? As I said, it's never the first option, even though a third of older adults do use sleep medications. There is a higher risk for adverse effects in older patients, and you really want to try to limit that use if possible. In terms of herbal medications, there's no strong evidence to support effective impact by most herbal medications, melatonin being the exception. It can help, but again, I would say use it with caution and discuss with your healthcare provider. Over-the-counter medications, use them carefully, short-term, and again, what are the underlying reasons why you suddenly had some sleep changes? And that's the most important thing to figure out because you want to catch any things early. And if you're doing the other kind of sleep health promotion things, you may find you are just generally feeling better and healthier as opposed to trying to use a sleep aid. Prescriptive medications, sometimes we do need sleep pills, sleep medications. Hopefully, short-term benzodiazepines such as Zalpion or Zopiclone, they're often common ones. And again, having that discussion with your provider, finding out if there are other root causes that you may be able to address, or that you can help to reduce the dosage by using good sleep health and hygiene practices. So just to conclude, sleep disturbance is a really significant health and quality of life concern for many adults as they age, whether in community or acute care or long-term care. Good sleep health contributes to well-being, vitality, and can support recovery and healing. Small changes to our habits and activity levels, diet, and environment can have a really big positive impact on the quality and quantity of sleep that we get. But if you're still having challenges with your sleep, you should be sure to contact your healthcare provider to discuss your concerns. So I'm happy to take any questions that you might have. And I will open up the floor.
And I'll help if there's more than one kind of coming at once. So again, thanks everybody for joining in. If you want to, what happened? The screen went wonky, there we go. If you have a question, you can put it in the chat box in the bottom. Any comments or anything, that's fine. I'd like to say that was really great information, lots of good take-home messages. I think while you were talking, I was kind of thinking ahead into my bedroom and thinking maybe I need to change my sheets and maybe I need to do a few different changes with my lighting and my window coverings and stuff. So hopefully we can get some better sleep in the near future. So that was really great. Those were all really good tips. So if anybody has any questions, feel free to use the chat box.
I just wanted to ask about the use of these herbals that I've been using. They're called Rescue. It's just something that you use. I think there's lozenges and there's also a spray. And I just wondered if Dr. McMillan has any knowledge of them. They're Bach flowers, B-A-C-H flowers. They certainly work for me.
Well, I'm happy that they do work for you. The Cochrane Review, which is a sort of a compilation of good scientific evidence. I don't recall that it included that particular herbal, but the evidence to date that I'm aware of suggests that there's really not a lot of strong support for herbal medications except for melatonin, which is listed as a herbal as opposed to a over-the-counter medication. It kind of falls in a different category. What we do know is sometimes, like if they're in a tea or something where it's sort of warm, hot water, that can kind of make you feel warm and sleepy. But so far as I know, most of the herbals don't actually seem to significantly contribute to better sleep. Now, it's great that that works for you. And so long as there seem to be no side effects, well, that's good. You might want to have a look at what the ingredients are, but I would say, use it with some care.
One of the flowers is impatience.
Well, we're learning more and more about different kinds of things, but as I said, the evidence so far doesn't really strongly support their effectiveness.
So we do have one question that someone entered in the chat box. It says, what do you think about wake lights?
Wake lights, like sunrisers?
I guess so, yeah.
So those lights can be really helpful for individuals who find it very difficult to wake up. So if you're meaning those lights that sort of gradually, sort of brighten your room as if it's like dawn, and they can be really nice, especially in our long winter, dark months, to help us transition from that, sleep to wakefulness. And for some individuals who have a hard time transitioning, they can really be very effective. It's sort of like having, spring in your bedroom on a regular basis. And I guess one of the things that's really important to think about is that it can help to entrain that circadian rhythm, right? So that it's keeping you to a regular wake time. And so that can really help to line everything up. And when all of your different rhythms are like the symphony, you actually feel better. So, I'm supportive of that. They've had some really good proven effectiveness.
Yeah, and the same comment, same individual just said, I guess they do the opposite at nighttime. So they dim.
Yes. Yeah.
Yes. We can very much align with that rhythm that you've been talking about, that they rise for the morning and then dim for the evening. So that's great. Anybody else have any other questions for Dr. McMillan? Again, you can use them in the chat box.
How do you work the chat box?
Well, you've got it, Stella. You can just ask a question if you have one.
Well, I just wanted to give a suggestion. You know what? One of my nephews is a medical student, and he's told me about these glasses that you can put over your glasses called blue blockers.
Yes.
Have you heard of them?
Yes, I have. Yes.
I use them if I do any work on the computer at night.
Mm-hmm. And that's perfect because it's the blue frequency of light that actually is the part that suppresses the melatonin. And so you want to make sure that those melatonin levels are rising, and so that they'll help you to start to feel sleepy and ready for bedtime. But if we're, out looking on our computers or watching, TV late, especially on the computer though, because there's quite a bit, computers can be quite engaging, and before you know it, you spend 3 hours on Facebook or something. And that bright light, the blue spectrum, suppresses the melatonin. And so wearing those glasses will allow your melatonin levels to come up. So I've done some work in the high schools, and my goodness, they have a terrible time though. They're on those games and they're, checking their phones throughout the night, and it's very, very bad. So getting your cell phone out of your bedroom or turning it off, for example. I don't even recommend having a television in your bedroom. And for those of you who have a pet, they can be pretty disturbing if they jump on your chest or something. So, just you might have to put Fluffy into the kitchen or something. So,
Diana, it's
hello. Hi, Barb.
Nice to see you. Thank you for the presentation. I've got a couple of questions. My husband is suffering with some dementia, and he's got his days and nights really turned around. Do you have some specific strategies that might help with that? And obviously, it's worse because of COVID and not being able to get out and about and stuff. But I'm just wondering if you have any other suggestions. Otherwise, what can I take so that I can sleep in between?
Unfortunately, there's a lot of challenges with dementia and sleep disturbance. Although some of the sort of the presentation of dementia can be exacerbated by sleep deprivation. And so what we see is that if we can help individuals who might have some dementia get their optimal amounts of sleep, they actually may be cognitively better. So some of it gets masked, like some of it contributes, some of the sleep deprivation or sleep disturbance contributes to those symptoms that look like dementia. So that said, trying to get exposure to light, even if it's sitting by the window, walking where possible. It's really tough these days, and we're in the middle of the winter, so that just makes it a double whammy. But if it's possible to get out, to get some fresh air, get some bright daylight exposure, or even on a dull day, that amount of outdoor light can still be really therapeutic. And, it is a challenge. They often get a bit more confused later in the day, but if there are ways to help get some exercise in, so they get healthier fatigue, and, keeping in touch with your geriatrician to see what other medications might be helpful to reduce anxiety, if there's some of that that's maybe contributing to his sleep loss. Right. And then seeing what you can do. Is there something for you to get some respite? Because it's exhausting as a care provider, and you need your sleep in order to, be the best care provider too. So, looking after yourself is a good way to look after somebody else.
Yes, easier said than done, as you well know. What about you didn't mention? What about CBD oil? I didn't see any recommendation or any suggestion there. Any research around that, Diana?
Well, there is an active group of researchers. I'm part of the Canadian Sleep Society, and there's an active group of researchers investigating some of those. We weren't able to do very much research previously because it was an illegal substance. Right. And so that research is really just coming on board. So I unfortunately don't have a lot of conclusive evidence. There does look to be certainly some support that, through its actions for reducing pain, it can offer a lot of support for that and reducing stress as well. But I think the jury is still out in terms of exactly how it impacts sleep. And so hopefully next year, I will have more to say on that, Barb.
Oh, great. Okay. Keep in touch. Thanks. Take care.
You too.
So Diana, there's one more question, and then I think we'll wrap it up just to be respectful of your time and everybody's time. So we talked about the blue screen or blue blocker glasses. So someone's just wondering, can you get, and maybe you don't know, I'm not sure, a cover for your screen for maybe your laptop or your tablet so that maybe you don't want to wear the glasses? Can you just get something that puts right over your screen?
Yes, I've heard of them. I don't know where you can get them, but I've heard of that, and I've also heard of and there's also apps that you can settings in your computer that you can use to have more of a dim setting for nighttime. So that can be helpful as well. So
okay. So clearly, we maybe need to invite Diana back for another talk. This was a great evening with lots of good questions, and but we're going to start wrapping it up. And again, a huge thanks for everybody for coming out tonight. We do have our next talk is next week, Tuesday, and the information will be on our Facebook page and our website. So you're more than welcome to join in. Again, I just wanted to say thank you to everybody. It was nice to see some faces. It was nice to see everybody coming in. Hopefully we can see you back at the center really soon, and have a great night, everyone. Thanks again, Diana.
Thank you.
Oh, you're very welcome, everyone. Thanks for the
Diana.
great questions.
Thanks.
Take care. Sleep well.